There are many techniques in breast reconstruction, ranging from only using an implant of some sort to using your own tissue of some sort, or to using a combination. And again, everyone is patient specific. If you have a patient with a really thin abdomen who doesn't have their own tissue to use, then an implant is going to be the best choice for that patient. If you've had a patient in their 40s or 50s who've always wanted a tummy tuck because they have abundant abdominal tissue, then using that tissue in a muscle-sparing technique can be an excellent option. However, those patients still can choose between the gamut of breast reconstruction options. And there are some patients who don't have anything specific, and they have to use other more creative options. And again, here at Park Meadows, our goal is to help you decide based on your desires. Also, patient preference plays a huge role in this. Some patients really do well with implants. Other patients don't want implants at all. And therefore, each treatment plan is tailored to that particular patient when they walk in the door. At Park Meadows Cosmetic Surgery, we offer all of the techniques for breast reconstruction, running the gamut of implant-based reconstruction, using a tissue expander or an implant strategy, using an implant alone, also moving to the autologous tissue. Autologous tissue is a fancy word for using your own fat and skin. Our preference here is to use muscle-sparing techniques, which is unique in the region, and therefore we use a lot of abdominal tissue for women who have that available. Also, there's other donor sites, such as the internal thigh or the buttock, that can be considered. And then there's a combination of techniques where you use both your own tissue combined with an implant. Those are usually staged approaches, and those can be more complex than this video would allow us to discuss. Also, it's important to know that women who've already had breast reconstruction may benefit from evaluation as well. There are many secondary shaping procedures that can be done if they're unhappy with the shape or size, or if they have complications from a previous reconstruction, such as a 10-year-old implant, if that becomes painful or symptomatic. These are things that we can also evaluate and either remove the implants in favor of using their own tissue, or remove the implants in favor of fat grafting, or there's many options that we can discuss for each patient depending on their preferences, the defects we're dealing with, and the history of the operation that's already been performed. A tissue expander is an inflatable implant that can be adjusted post-operatively. Typically, the classic tissue expander today is a silicone shell that has a port that you can access through the skin with a small needle. It allows the implant to be placed deflated, and then you expand that over time. And it helps to save the place of the mastectomy. It helps to expand the muscle or the skin after the mastectomy, and more importantly, helps that patient heal. And often, if they need further treatment such as chemotherapy or radiation therapy, those tissue expanders can save the place of the next stage, and then that breast reconstruction can be completed after all the other treatments have been given.